I know why you are ignoring your health in the most part, especially your sexual health. And I'm going to give you 5 reasons why you are doing that. Secondly, in this video, I'm going to tell you why it is important for you to stop sitting on the fence about your health, especially your sexual health as a man. Then I'm going to go ahead to give you exactly what you need to do today, tomorrow, by visiting your doctor to ensure that your health is safe. Of course, you must have gotten why you shouldn't even refuse to do this third step. If this is the kind of video you want to see, then don't go anywhere. If today is your first time, you are in luck. Welcome, and please do join this big family by liking this video, share it, subscribe, and tap the bell button as well so that you don't in any way miss any of my videos. This is the men community, and right here where I talk everything about self-improvement for men and unveiling women for the men who love them. Let me tell you something, guys. Women are worried, have been worried for generations. Let me give you an instance. I always used to wonder why most of the guys, all of the guys that I met, not most, all of the guys that I met before I got married who wanted to date me or who dated me, always never bothered or sought for their safety when it comes to sexuality. And it bothered me. How do you just say me, oh, I'm a fine girl, you want to date me, you love me, and then you want to jump into bed right after that with me without knowing whether I am safe, whether I am healthy, whether I am, spiritually clean as well. It bothered me for the longest years. I will tell you that one of the things that made me marry who I got married to eventually was because that was one of the first things he discussed with me, and I felt, oh, boom. So I know that yes, you guys are out there, but the vast majority of brothers and kings are not doing the men community any justice. It's sad. So these are the top 5 reasons why men have been said to not bother about their sexual health and their health in general at all. In fact, I have this mantra that I always say.
Before you see a man in the hospital, best believe he was wheeled in by loved ones or family members, and it has become an emergency.
And at most times, they never get to survive it. We need to change this trend, and that's why this channel exists. And this is also why you should take the crusade to your friends, to your brothers, because men's health matter. Men's life matter. Your life is so important. Remember, after you, there will be no you again. You are just like God, your maker. There is no one like you. They may look like you, but they won't ever be you. Drop in the comment section what you first thought when you saw this topic and what you're going to do going forward. Yes, I haven't spilled the beans, but I'm going to go straight into that right away. Okay, so these are the top 5 reasons that men don't bother with taking care of their health, taking care of their sexual health in particular. Number 1, stigma and shame. So most men don't want anybody to look at them and say, oh, I heard he has this XYZ. I heard he's suffering from XYZ. But then you better start going earlier to prevent such situations. And we are all binded by our common humanity. Sickness is no respecter of persons or gender. So why would you allow what people say and how they will feel that you don't even know about yet? How will you allow that prevent you from pampering yourself, from taking care of yourself? And I understand, because things about men's health are viewed a bit differently, right? So things like low libido, premature ejaculation, infertility of all sorts, inability to procreate at all of those things brings a lot of shame to men. But these are things that can be prevented if you take the next tips I'm going to bring in this video. So stigma and shame is one of the reasons. Valid or not, I think you should unseat from that fence. The second reason that has bothered men, made them to cower, make them to hide when it comes to seeking medical help, is lack of access to healthcare. right? So most of them are like, okay, so these things are not even available in the first place. People are not also orientating men enough about taking care of themselves, so they can as well just move on with their lives. This is really sad, right? Access to healthcare is very important, especially in a world where women's health and children's health and every other person's health is considered first off before talking about men's health. In fact, men's health is so hardly mentioned, sadly. I know. But then you have to prioritize yourself enough to take it seriously. I was speaking in an event 2 weeks ago, and the person who was the host actually is one of those people I heard in my life who said he went for checkup and he does that regularly. And I was like, you're a different kind of man. And I need you watching me to be that kind of different kind of man. No matter how old you are right now, know that you're important. It starts from understanding who you are, right? The next reason that men don't bother is fear of the unknown. So, okay,
I don't want to go to hospital because I'm feeling this pain in my pelvic, and I get there and the doctor tells me it is prostate cancer.
Or the doctor tells me something really terrible. I don't know how I'm going to survive it. Yes, research have shown that more men than women have low self-esteem. So you don't have to cower. You have to sit up, take the blow. That's part of life. You don't have to run away from facing challenges. And the earlier you go, the possibility of those things not happening are higher, right? So because you're afraid, it shouldn't stop you from going to cater for yourself. So you don't want to be diagnosed of a serious health condition, then you sit in and make it worse. That's not wisdom, if you ask me. The fourth reason men don't bother taking care of their health is cultural barriers or language barriers. So some people, because of how they think about their culture or so, they feel like they might not be understood when they go to some health centers or so. Some are also, language barriers, like how am I going to explain to them how I'm feeling, we don't understand and all of that. But please don't let that stop you. And again, because of the way men's health has also viewed in some cultures, so most men are being different about they might not be able to handle me well and all of those. The fifth reason that most men have denied themselves care is the expectations from society. So they feel like, society expects us to be strong and all that. Going to the hospital to see a doctor, run tests, looks like something that is just for women. It looks like something that weak people do. Guy, stop that. Stop doing this to yourself. It's not. You're actually strong when you can subject yourself to these things and get yourself healthy and strong at all times. A lot of people in the brotherhood are going through a whole lot. And this crusade that I am on is to help you come on my side and help you, brother. Help brothers, help people in your men community, help women, help those men in your church group, help those men in your mosque group, help those men in your corporate society. Let's save the life of more men. These are 5 main things. There are many other reasons why people don't bother, especially men don't bother to take care of themselves, but I'll go straight into why you should care about your sexual health and about your health in general. Number 1 reason why you should: you're able to reduce the risk of sexually transmitted infections, especially if you're sexually active already. There's nothing I can do about that, especially if you're single and you're now sexually active, or you were sexually active without even your consent as a boy, which is a very sorry case, which is another reason why I'm here, because a lot of men are dealing with these things silently. In fact, some people believe that they have overgrown it, they've gone past it, but no, the trauma is always there. It's always there. But I'm sorry about that. I'm sorry you had to go through that, right? So if you're able to present yourself to a doctor, by the time you present to a doctor, you can have a confident doctor who can tell you the truth, who can run this test, who can help you stay away from sexually transmitted illnesses. The bad thing about this is that if you don't treat this in early, it gets into becoming a big deal when you're married. And then I know a few people who can no longer impregnate their wives because of something they didn't deal with when they were boys, when they were men. STIs, you don't play with those. You don't. So that's one reason you should, say,
Okay, I'll do this for myself.
And the consequences of not doing this is so huge. It can lead to cancer, it can lead to even death. Number 2 reason why you should take your health seriously. It helps you improve your sexual performance. So if you're able to take care of your health, go for checkups, do your tests, when you're ready to be sexually active, you are able to be strong and go through years strong without having to have anything put you down, have things cause you low libido because they are untreated. You won't have issues of erectile dysfunction and curvatures and all of those things. You won't have issues with premature ejaculation because all those things would have been dealt with ahead of time. You know what I mean? So if you want to be strong, masculine, give her the run for her life, you know what I mean, in the sheets, then that's one reason you should not neglect taking care of your sexual health. Meet your doctor. The 3rd reason why I think you should totally subscribe to taking care of your health is you are able to detect risky sicknesses earlier. Yeah, right? So you're able to detect if there's going to be a cancer and prevent it. Detect whether, especially cancers like prostate cancer, testicular cancer, and all of those kind of cancer, that men are prone to. You're able to detect them ahead of time and then go for the cure really fast. And it makes the treatment easier and makes it work when you can detect them early. You know what I mean? It's very, very, very important. Okay. The 4th reason why you should go for checkup, you should take care of your health, is that overall health, your weight, all your systems and cells will work properly when you are regularly checking, when you know exactly the state of your health. So your overall health, your strength, your virality will be on point. You don't want to be failing. You don't. When you take care of your sexual health, you're going to reduce stress. All those stress-induced sicknesses will not be there. Your mental health, you don't have to be worrying, silently dying, getting in and out of depression. All of that will not come in. Also, you will not be bothered about what people think. You won't be anxious about who knows what this is. So you save yourself all of that heartache. Your overall health and well-being will be stable and good when you know exactly how your sexual health is going and you're taking care of it. Finally, another reason why I think you should not sleep on this, your reproductive health is so important. You can't play with that. You are an ancestor, and that's my prayer for you. You're going to have children, and you're going to have children, and they're going to look back and thank you, their grandfather, great-grandfather. Amen. Right? So for that to be possible, your reproductive health has to be on point. You have to be able to make babies that that are healthy, babies that are on point. And you can only do that when you start taking care of your health now. If you're single, now at whatever age you are, it's never too late. It's never, never too late. And it will enhance your relationships. So you're not going to be afraid of whether, she's going to blame me for this. I have to tell her the truth. I don't know whether I should tell her that things are not working. I don't know whether I should tell her this. All of that, you're going to be happy in a relationship when you get into a relationship with a woman. So it's so important. I hope I'll be able to convince you, right? Now, let me go straight to the laboratory test. I'm not a doctor, caveat. I'm not a medical person. I'm just a content creator, bringing to you some of the things that I did also when I was getting married with my husband, the kind of tests my husband had to do, and things I think you should do. I'm going to put them in the broad basis. I'm not going to recommend any drugs or any specific tests in that sense. I'm not going to tell you broad aspects of the kind of test that will help you know the state of your sexuality right now, so that you can begin to know whether you should start treating for something and prevent something from going wrong. It's always better to know and be in control of what you feel and how you feel and what's going on in your body. Okay, now let me go straight to the test that I think you should go ask your doctor details about them more and get going if they say, yeah, you need to do that, if you want to be sure that your sexual health is optimum, is on point. Okay, I'm going to mention the common ones. Of course, you're going to do a test that will check for sexually transmitted illnesses. Check for STIs. Any test that will check for your STIs, check whether you have any and deal with them. Deal with chlamydia, gonorrhea, HIV, syphilis, all of those kind of tests. They will take maybe samples like urine, blood, also swabs. In some cases, yeah. So just go do that. I'm talking like an expert, I'm one of those people like you. I'm very, very weary. I'm very, very scared about blood and all hospital things, but recently I've had to, especially getting married, it taught me to just be proactive about my health. That's what I'm encouraging you to do. Don't just take your girlfriend, don't just take your mom, don't just take your wife to the hospital. You deserve to be alive for us, please. So STI test, very important. Okay, the second test you should totally do is PSA, prostate specific antigen. Okay, you know that prostate, well, women don't have prostate, so that's why you should know that this is specifically something you shouldn't play with. My dad had a rough battle with prostate, and we didn't know what it was till he graduated to cancer. Hallelujah, he's still alive. He got the best care. He had to do surgery, and do you know what the surgery takes? Oh my God, let's not go there. So to make sure that you don't get into that trap, or well, if you're watching this maybe 50 and above and you've already done the surgery, let's also share from your experience. Thank God for you. Let us know in the comment section how that went and why. So, reinforce what I'm saying by telling us why men should actually look out for themselves and go to PSA test. So prostate specific antigens are good. A second test I think you must have to do, especially if you have a family history of it and all of those kind of risks and you're above 50. This test is a must. Like, ask your doctor. Well, I'm not recommending, but ask your doctor. If you're above 50, he will definitely let you know that this is very important. If you're younger than 50 as well, there's no law that say you can't do that test. Just to be sure of the state of your prostate as a young man. Okay, the third test you should check for is your testosterone test. You have to check whether your testosterone is at the level where it is okay, optimum. That test is the one that helps you check whether you have low libido or likely to have erectile dysfunction, all of those infertility issues. This is the test that helps you detect it on time. The testosterone test is, for me, is a must. You should just go meet your doctor and he will recommend further how and which you should do. Okay, and this test is done using your blood sample, and you know that even when you are always feeling tired, you're always fatigued, you wake up in the morning, you're tired, sometimes your testosterone level might be low, and this test help you to find out exactly what the cause is. So don't sleep on this. Okay, the fourth test that you need to do is a fertility test. Especially if you are trying to conceive, you're trying to impregnate your partner, your woman, your wife, then this one is very important. Fertility test will check for sperm count, quality of sperm, the morphology, motility, and all of those things. Yeah. The final one I think you shouldn't overlook are urinary tests. Yeah. This urinary test can help you detect if there are any kidney infections, if there are urinary tract infections, and all of those. Those things can also affect your sexual performance and health. So it is very important to also run a urinary test. Don't do one and leave the other. As of course, when you discuss with your doctor, he'll be able to let you in on exactly what you should do, the combinations you need to do, or all that you need to do, right? If you're somebody who is actively trying to conceive with your partner, then I'll do another video to address that. Let me know in the comment section if I should do that video. Okay, all right, so as you come your way again, I hope you have been able to see the truths about men's health and why you should become deaf to what anyone is saying and go for gold, right? Until I come your way again, I remain your girl, Chisom. See you in my next video, which is really soon. Bye.